Once again in Diamed Diagnostic Center, we solve all your health problems such as prostate problems, infertility, you've been married for so long and no fruit of the womb, low sperm count, stomach ulcer, fibroid, liver and kidney problems. If you have all these problems and more, do make a date with Dr. Marina on Health Solution
for deep medical science facts and home remedy.
Hello viewers, we are going to continue our cycle of the health programs about internal diseases. These are health conditions that do not give early signs and symptoms. It is only diagnosed when a patient visits a health facility and the patient is examined by experienced and qualified health professionals. We are also going to give questions about our health conditions to Dr. Marina Yashunina, who is our medical director and an experienced alternative medical practitioner who always has the alternative way for health conditions.
Today we will discuss about very popular conditions of the ladies who is on the reproductive age. It means from 16 years to 56 years. We can just take this big diapason of the patient who is affected with the uterine fibroids. The uterine fibroids, it is a tumor, non-cancerous. But in some of the conditions, it can give a cancer or it can be just give a lot of negative impact to the human's body and especially affected and giving a lot of discomfort for the ladies. Now, we are just going to explain what is it and how it can be cured.
Dr. Marina, a lot of ladies ask, what is uterine fibroid? And what group of the age and statistical investigations do you have?
Now, we can discuss about this uterine fibroid. Uterine fibroid, it is non-cancerous tumor, which is just grow like hormone dependent. This is what the scientific people till now explain to us. We can be agree with it because we do our own investigation. And that non-cancerous tumor located inside in the uterus at different position and affected ladies from age from 17 years to 50 plus years. And it is affected mostly if it is in 17 years, roughly 6% of the population affected. And if we are going on the 40 plus, it is almost 70, sometimes even 80% of the ladies is affected with the uterine fibroids.
You can uterine fibroid, Dr. Marina HH so okay, a woman ya fibroid who I say, Adia if you feed a bahu dim na enya kokram, ye become say non-cancerous na in Himua, and I say in Pimpi, no dear, ye can say this are fibroid ba a hormonal imbalance, who swear walk or bahu, a CSS will bit many inside NCC and a man and yema if you feed a wobano audio. And if you move so chess and pimpino, a ma or more in Finchia Dunson, a year 17, a qua copy himself or many in Finchia Dunum 50 years a crown in the children. Almost our age group on a year or more particular motena, sa uterine fibroid. Now, or more 17 years, if you share Dunson, a mube 6%, and I am not a tower sour how. Dodona, your more reproductive age, economy, equal to 50, any 50 each.
Now, the uterine fibroids can be classified independent of their location. It can be submucosal, inside in the womb, subserosal, out of the womb, and intramural, which can be inside in the womb muscles. Then, it can be some of the like a fruit stay on the stick, it can be pediculated fibroids. When the people telling that some of the fibroids, when they take herbal medicine, can be jumped out, it is only submucosal fibroids can be jumped out, and if the size of that is not so huge.
Fibroid a yɛdi ho nkɔmmɔ yi anaasɛ nneɛma efifi wɔ ɔbaa awodeɛ mu yi yɛwɔ mu nkyekyɛmu ahodoɔ bebree. Deɛ edi kan yɛfrɛ no submucosal fibroid a ɛno deɛ ɛda ɔbaa n'awodeɛ n'ankasa emu baabi a ɛwɔ sɛ akwaraa ɛkɔtɔ fifi. Ɛna ɛwɔ subserosal fibroid ɛwɔ awodeɛ n'akyi. Ɛna ɛwɔ intramural fibroid a ɛno no ɛwɔ ɔbaa no awodeɛ no muscles n'ankasa mu. Ɛna ɛwɔ deɛ ɛtɔ so a ɛno no ayɛ te sɛ aduaba a ɛsɔ adeɛ so ne branch no ɛkɔka edua no ɛno no yɛfrɛ no pedunculated fibroid. Mpɛn pii nkɔfoɔ ka sɛ wɔn wɔ aduro a wɔn bɛtumi de ama ɔbaa no na ne fibroid no ahwiri anaasɛ apue firi n'ase. Deɛ bɛtumi ama n'ayɛ nokorɛ ne sɛ so ɔbaa wɔ fibroid na yɛ submucosal fibroid na esua ketekete ɛda n'awodeɛ no mu a ɛno no ɛna bɛtumi ama saa nneɛma a wɔn ka no ɛtumi ayɛ hɔ.
Independent of the hormonal imbalance, how the scientific people explain us, it is depend of the imbalance between the estrogen and progesterone. And when some of the hormones is going higher, like estrogen, and it is forcing and boosting the fibroid grow bigger and bigger, and the progesterone, when it is growing higher, it is make fibroid bleeding. According to these points, the symptoms of the presence of the fibroid can be followed. First of all, it is a heavy menstrual bleeding. When the lady has her menstrual cycle, the blood is coming overflow. It can be so extensive and intensive flow. Plus, additionally, it can give the menstrual cramps. It can give back pain. It is giving even vomiting. It can make miscarriages for the ladies who conceived and they don't know why the miscarriage is always 3-4 months and miscarriage coming. 3-4 months pregnancy, miscarriage is coming. It can be like preterm labor, even if the lady is pregnant and she has possibilities to carry the baby. That the baby couldn't be confirmed and make formation well, and it is given the miscarriages and destroy the family and destroy the lady's conditions and her health. Plus, additionally, if the fibroids couldn't be treated in time, sometimes the ladies is going to do some another different herbal medication, the fibroid is growing bigger and bigger, and they start feel like stomach pain, intensive and very frequent urination. And finally, if you don't treat that points, it start affecting the ovaries and it can give some additionally like uterine cancer and a lot of different side effects for liver, for ovaries and another, and develop different type of the cancer inside in the body. This is why we take your attention for these conditions, that it's supposed to be detect in time and receive the correct treatment.
Fibroid ya yegusu di hu nkomo ye di kan ka se eye ma husuo a ensisi su yie eye hormonal imbalance. Hormones mienu a ta ensisi su yie de fibroid oba eye estrogen and progesterone. Se estrogen no e wo soro a eno ma fibroid no enyini ntenten ya kese. E na se progesterone no so ekoso pii afi na amamoja etu oba no obu ni nsa moja betu ni saa be na wotwe mienu boso minimu nyina da bia obehu moja kakra e wo na ho saa ahoso ye nsisisu yi e na e de fibroid no eba e de nsunsuanso eba na nsunsuanso a fibroid ananse oba a enema afifi na owodie mu betimi e de aba de di kan e ye se obu ni nsa moja betu ni bebre boso minimu nyina obu ni nsa na wotwe mienu na moja ni ntwai obu wonso ebetimi ama nachi kase no ekọ ni sisi mu hono aye ne ya na ya se ebe we no aye ne ya afi emma ne menses anase obu ni nsanso a ensisi so yie ebetimi aha oba ewo ebra wafa afuro se na nyinsen no enko mboro boso me nsampo na asai obi won ma waware wa nyinsen be mpre nan enu eye ya na asai a emfa ni gie ma ware ni e na afi so no ebetimi ede preterm birth sɛ ɔbaa betumi nyinsɛn but onru bosome nkunu sɛ ɛwɔ sɛ ɔkɔwo no ebia bosome nsia nson na wakɔwo premature baby afei nso ɔbaa nya fibroid a ɔde nenam epe nnuro na advert kɔ so sɛ bibiduro wɔ ha bra bɛgye etimi di nsunsuanso bebree ba ɔkɔnum bibiduro na ebetimi akɔfa ɔhaw foforɔ de abrɛ ɔbaa no ɛwɔ ne honam na kwaa ebetimi ama ɔbaa nso adwonso ntɛntɛm kakraa bi na ɔkɔ akɔdwonso afei nso ebetimi de ɔhaw abɛto honam na kwaa a ɛbɛn ɔbaa na wodeɛ no na sɛ wanhu ne ntɛm ensiesie na ɛmfiri hɔ a ebetimi akɔfa nsunsuanso koraa ma wakɔnya kokram cancer ɛwɔ ɔbaa no awodie nim ebetimi ahaw ovaries no ebetimi akɔhaw brɛboɔ afei ebetimi ahaw kidney ne honam na kwaa ɛbɛn ɔbaa no awodie no ɛnu nti na yɛtu ofo sɛ kɔ ayaresabea anaasɛ tu anamo bra yasoɛyɛ na yenye wo nipadua nhwehwɛmu enhu yare ne ntem na yɛma wo aduru a ebetimi aboa atu ase.
After 2 miscarriages, I was diagnosed of uterine fibroid. I was so scared. After several doctors offered me surgery because that's the only solution to my problem. A friend of mine had 2 surgeries, but the fibroid grew again. I just visited Dr. Marina's clinic and I successfully conceived after she treated me with her natural herbs without surgery. And now I am so happy with the baby. My sisters, at Dr. Marina's clinic, her medicine really works.
What are some of the existing methods for treating fibroids and which the ladies are afraid to embark on? Is there an alternative way for treating fibroid?
You are giving me the very nice and good questions, and we can just explain that existing method of treatment fibroids till now, 21st century, it is stay surgery, myomectomy or hysterectomy. When they just remove the fibroid, make a surgery, and the lady fear about it because this method of therapy giving a lot of negative impact for the lady's body. First of all, it is a scar. The second, it can give infertility. The third one, when the side effect out of the surgery coming, that the new fibroid is grow back again. Because surgery doesn't dissolve the hormonal imbalance, which can be the cause of the fibroid creation. The second method of the existing method of treatment, it is a gonadotropin release hormone agonist. It means it is a tablets what the chemically the ladies start take, and it is just stop menstrual bleeding, stop everything, and the fibroid, because the hormones is completely cancelled, and the fibroid is start shrinking and stay like a stone inside in the body inside. The next one, it is just existing method. It can be some of the radio waves and ultrasound waves, and it is a new impact. We call it as small invasive therapy. But all of this, what I mentioned now, existing methods, what is negatively impact that it is caused and create infertility issue. That under this treatment, the lady couldn't conceive at all. It is make like a earlier menopause, or it is a completely create infertility.
Akwan ahodoɔ a sɛ ɔbaa wɔ fibroid anaa nneɛma afifiri wɔ n'awodie mu a mpɛn pii no ɔkɔ ayaresabea a yɛfa so ɛdi treat ne sɛ ɔkɔkɔ akɔyɛ operation yɛfrɛ no surgery. Surgery no yɛwɔ mu ahodoɔ bebree. Deɛ edi kan yɛfrɛ no hysterectomy. Obi wɔ hɔnom a yɛbɛkɔ akɔyi n'awodeɛ no, total hysterectomy, yɛbɛyi n'awodeɛ no nyinaa afiri hɔnom. Na ɔbaa waduru ne mfie so ne ne mpɛmpɛn so a waware na awoɔ maa yɛ a yɛkɔyi n'awodeɛ no. The insunsuanso bebree te sɛ infertility ontimi anyinsɛ ngu biemu ɛwɔ asase so da. Afei nso no ɔbaa no na wodeɛ no surgery na wɔkɔ akɔyɛ anaasɛ operation no ebetimi de temakyɛ aba na wodeɛ no ho a sɛ yɛnyi na wodeɛ no nyinaa kɔ afiri hɔ a ontimi nyɛ dɛ ɛnwo. Deɛ tɔ so ɛyɛ nnuro ɛyɛ hormonal drugs a gonadotropin releasing agonist yenura yaye no chemical oba no kwa na de amana no na astopi hormones no emma ahosu a yedi kan se ensisi su yie no na amane kofom kra nti be bosome miensa bosome na ensia kra na oba na emu ni nsada eba san so a ontimi enyinsen ayeno so wonsunsan so bebre de etoso other non-invasive methods say oba no fibroid no ye ketewa na ewom no ombekwa akoyi ni nyina bepie operation no so say ye oba operation na say ye de sekan ekotwa fibroid free wa na nkire say fibroid no asiatu ho ye ni ma bebre a oman operations be enan enum ensia afi ba ko mfie mienu pe na fibroid no asan ba efiri say hormonal imbalance ya ahosu a ensisusu yie no say wokokoyi operation na saa de ni nsiesie into fibroid no be san ba.
How we just explain about the existing methods. I just forget to mention the progestin release intrauterine device. All of mentioned existing methods, it is just like contraceptive and prevention of pregnancy. And it is not boost your fertility, and the lady after this treatment has a very big questions. Can she be pregnant after that treatment or not? This is why a lot of ladies are feared and they are just looking alternative way how it can be cured. And at our center we have a scientific target and scientific goal to prepare some of the alternative remedy which can be prepare and give possibility not only shrink the fibroid and dissolve it complete, but additionally boost fertility, treat additionally side the negative impact of the fibroid to the body, and boost fertility that the lady can conceive, fibroid will be shrink, and it will save and protect miscarriages that the lady can carry the baby and deliver it in term.
Ekwan foforo baako a oba wanya fibroid ye omudi treat and they say ye free bibi progestin releasing intrauterine device ye de ade kwhye oba no awodi enim na ede hormone a ye friend progesterone na ba sa ahosuo no esi oba no nyinsan no kra entimi ma oba no enyinsan enti enema a yabobọ so nyina ye de treat fibroid no empempi esi oba no awo ho kwan enuti na ekwan foforo a eye Dr. Marina ne na pamfo aye hwehwemu a oba yaso ya ye bema o sa treatment ya enkofa miscarriages bia ama se wanyinsen na nyinsen ntimi nyina na bese afenso enkofa pre-term na se unko deliver akwara a onru ne brese e wo se ye de ye wo no afenso no emma oba no bu nsa moja no emma bebre sa ekwan fufure alternative way ya Dr. Marina ene na pamfo asiesie ena ye buso ebe abechirechiro se wo sa wo hawo na wo de beba na ya hwewo asiesie okra.
Our medical facility, together with the Kwame Nkrumah University Science and Technology Pharmacology Department in Kumasi, has a target and goal to prepare and find some of the solution which can have a natural remedy, which can save woman fertility, boost fertility, cleaning ovarian tubes, and help the lady to conceive and have a normal labor during the pregnancy. And that solution was found.
Yasua ye ene Kwame Nkrumah University of Science and Technology aka bomu eye hwehwemu afa aduro sonko a eboa ma oba a wanya fibroid no ebeboa ayi na fi honom enkakra emfa ensunsanso boni bia mbre oba no na se wonyim ko a nyinsan no ebetimi akọ ne mpempenso akodu bra ewo so wo saa ehwehwemu yi ye ne Kwame Nkrumah asuapon no ene ekabo mu a yetimi aye ehwehwemu ehu aduro kropote ai oba wanya fibroid no ye de manu a ebetime siesie na wode no na ayi fibroid no nso afiri hɔ.
The natural remedy which was found together during our investigation, it is just stabilize the hormone balance, shrink the cumulative tissue what is caused tumor itself, it is just shrinking. When it is stabilized the hormones, it is the gonadal hormones, it means sexual hormones, which is producing inside in pituitary gland, which is located inside in our brain. Then it is going to our ovaries and to the womb and just shrink everything, stabilize the hormones and shrink the fibroid. And during the investigation, we find the duration of the solution. And duration coming from 3 months to 6 months. Never mind which of the location fibroid has. It can be subserosal, submucosal, intramural, pediculated, never mind which of the location is. Plus additionally, the size. Bigger size is shrinking faster. Smaller size, it is shrinking, but it is not visually can be detected that it is shrink so fast. Because half centimeter shrinking only 2 millimeters, or it is a 20 centimeters shrinking 10 centimeters, and you can see it visually. And especially when the lady has a multiple fibroids, it means all the fibroids shrinking together, and the lady start feel like it is movement inside, because all the fibroid coming to the normal condition, and the uterus together with the fibroid shrinking and stay normal shape, normal size. Everything coming and stabilize the normal menstruation, normal hormonal balance, and even the cholesterol, which is usually going high, it is stabilized. It means the ladies who is under our medication shouldn't take additional medicine for the high cholesterol.
Saa yɛhwehwɛ mu ya yɛne Kwame Nkrumah suapɔn no ɛyɛ a yɛnya saa aduro yi no. Aduro no ɛbotaeɛ anaasɛ ne dwumadie kɛse a ɛdi paa ne sɛ ɛboa siesie ahosuo ɛyɛ hormones na ɛnsisi so yie no. Na afei nso no fibroid tissues no aboa ayi ne nyinaa anaasɛ atwetwe ne nyinaa afiri hɔ dissolve no kakra afiri hɔ no. Ɛno nti wɔn a wɔn baa yɛso ɛyɛ a yɛde saa nnuro yi ɛmaa wɔn no ɛmfa ho ne o fibroid no ne kɛse a ɛyɛ ehwehwɛmu no ɛma ne kɔkɔ dɛ de sɛ efiri bosome mmiɛnsa so ɛkɔ ne bosome nsia so no yɛma wo saa aduro yi a wobɛhu nsunsuansoɔ a ɛbɛdɛ de sɛ o fibroid no ayɛ dɛ anane ɛkɔ fam koraa. Ɔmo fibroid no esusa no wo hyɛ aseɛ eyusu aduro no a wobɛhu sɛ o fibroid no nsunsuansoɔ aba so a ɛhyɛ aseɛ anane kɔ fam. Na mmom wobɛhu ne kɛseɛ paa yɛ ɔmo fibroid no so. Ɔmo fibroid no apagya ɔmo yafunu hu ɔmo abɛka sɛ sɛbi ɔmo nyɛ bɛɛ bosome mmiɛnsa ne nan. Wɔhyɛ aseɛ yusu aduro no bɛɛ bosome mmiɛnsa ɛkɔ ne bosome nsia no mu no wobɛhu sɛ fibroid no akɔ fam. Afei nso ɔmo fibroid no dɔɔso deɛ friend no multiple fibroids no ɛbɛtwitwi ne nyinaa ba bɛboa no ahyɛ aseɛ dissolve no nti ɔbaa no ɛhyɛ aseɛ no maduro no a wobɛhu sɛ fibroid biribi nam ne yam anaasɛ n'awodie no mu na asɛ ɛba bɛhyia ɛwɔ awodie no mfimfini. Wei ɛyɛ hwehwɛmu a yɛayɛ ɛde aduro sonko yi aba a ɔbaa wakɔ ayaresabea na yɛsɛ wowɔ fibroid no wobɛtu anamo na wode aba sɛ wo fibroid no yɛ subserosal fibroid o sɛ yɛ submucosal fibroid anaasɛ ɛyɛ intramural fibroid wode ba yɛhyɛ aseɛ ma waduro no a ne bosome mmiɛnsa so ɛkɔ ne bosome nsia no bɛhuhu sunsuansoɔ na wankasa nso bɛdi adanseɛ sɛ wo fibroid no akɔ fam koraa ma na kakakra bi a ne nyinaa bɛfiri hɔ ɛde anigye aba wɔ brabɔ.
To detect the presence of the uterine fibroid, you can do in any facility who has ultrasound scan, MRI, CT scan, and any other image remedies. Then you can just come and visit our facility, or you can visit our website www.diamedghana.com, or you can call to the telephone numbers which you can see on the screen. We have our branch in Accra, we have Kumasi, Takoradi, and Tamale in Ghana, and we have a Lagos branch at Victoria Island in Nigeria. If you have any of these mentioned diseases, we just advise you before you have a decision go to surgery. Try alternative medicine way, natural remedy. We just advise you, try our medicine, our herbal combination, and if it doesn't help you, you can go and have a different decision. Welcome to our place. Stay with us.
Dr. Marina yasuye ayaresabe yasuye oyare a wode anante a wonya nuaduru te se fibroid ye tuufo se bra ne beso alternative way no ehwe bra ne yema waduru a Dr. Marina ene na pamfo yesiesi ya ye de bema no na se wono na se wa no wo fi se wonya nsunsanso a fe na wadwen se bi ebia wo pese okoye operation na se okoye osebra if you say edru no eye adwuma wo yare a wode anante se eye chronic disease eye kidney mu ha eye wo liver eye prostate oba ne bema amaware mfie bebra mo pa awo na awo ne ma fabra yaso eye afi so wo yafun na ye oya wo chronic ulcer disease ana se wo chikase ene ye oya eye osisi yare bi kra ba ye friend sciatica eye wo sire mu nyina na ye oya to ana mo fabra Dr. Marina asuye na onsa yare yi ema wo kwanso nkoso ubetimi akohwehwe ye ewo internet so www.diamedghana.com anase YouTube nso Diamed TV ewo hono mu a ubetimi akohwe Ghana ye branch ewo Nkran ye wo Kumase ye wo Takrade ena Tamale ena Nigeria nso ye wo Victoria Island Lagos Fawiyare a wode anante a wonya no aduro no ebra Dr. Marina asuye na yentu aseye